Michelle, what do we know about this latest comment from the WHO chief on the origins of COVID?
So the issue here is how aggressively and openly the experts who went into Wuhan and into China were allowed to dig into the origins of the coronavirus. Part of the issue is what they were actually asked to do. There's some disagreement about that. Some people want them to have done an actual investigation, and others just wanted them to, basically line up where future research should be. The problem is that they did not get good access. They didn't get unfettered availability to ask the questions that have to be asked in order to get the answers as to where this virus came from. So that's what we're seeing from the WHO. The chief said that he believes that they did not get full access, and that while he doesn't think that it's likely that, for example, the virus came from a leak out of the lab in Wuhan, it is something that needs to be investigated. So that's where we are here on this topic. There is a lot of criticism that we don't have answers yet. There is speculation. There's a belief that this did come from a bat via perhaps another animal, but we don't have a definitive answer yet, and that's what the White House and the WHO is saying we really need to get that final answer.
Michelle, do we have a definitive answer as to the safety profile of the AstraZeneca shot? Are there still concerns here?
Right. Great segue. With science, with all of these topics, it is just difficult to know. The problem here is that these clots that are occurring are happening in pretty low levels, and they are known to happen in people who haven't gotten the vaccine. So it's very difficult to prove a negative. It's very difficult to prove that the vaccine is not responsible for these clots that have been kicking up. Now, we have seen in the last 2 days both Canada and Germany putting new restrictions on the AstraZeneca vaccine. And there just are lingering questions about whether or not this vaccine is entirely safe. The problem with vaccines is that you give them to people who are healthy, who might not ever fall sick. The intent is to protect people against a theoretical risk that could come in the future. So people don't want to take any risks, and that's the challenge.